Hi, Mike Gibson, Gregg Stone coming to you from ESC 2023. Greg, you're presenting here a network meta-analysis comparing IVUS and OCT to angiography, and then some of them compared to angiography, IVUS and OCT separately to angiography. Talk to us about what you found.
Well, thanks, Mike. As you know, there have been a lot of prior meta-analyses looking at intravascular imaging guidance versus angiography guidance for drug-eluting stent implantation. And most of these studies and meta-analyses have shown reductions in overall major adverse cardiac events with intravascular imaging guidance. But none of the prior meta-analyses have actually shown a reduction in either all-cause death or myocardial infarction. And most of the prior studies have been with intravascular ultrasound or IVUS guidance and not with OCT guidance. So at the ESC hotline session this year, there's actually 3 new major intravascular imaging guided trials that are being presented in the same hotline session, all about optical coherence tomography. 2 of these are randomized against angiography guidance, and that's the large international Lumion 4 trial, for which I was the study chair of, in high-risk patients and complex lesions. That was 2,487 randomized patients, the largest such study to date. And then there was the European-based October trial in complex bifurcation lesions. That was 1,201 randomized patients. In addition, S.J. Park and Duckwu Park are presenting the OCT-IVUS results, which is a head-to-head comparison of OCT-guided and IVUS-guided PCI implantation. So huge amount of new data, over 5,600 patients. And so the Lumion 4 and October investigators got together and we've collaborated to prepare an updated so-called real-time network meta-analysis to examine the effects of overall intravascular imaging guidance versus angiography guidance alone, and then to separately look at OCT guidance compared to IVUS guidance. And we pulled the results of Lumion 4 in October that were just presented, but we don't yet have the results of OCT-IVUS, which we will be updating right after the presentation.
And what did you find when you pulled those 2?
So, Mike, altogether with those 2, there have now been 20 randomized trials of intravascular imaging guidance versus angiography guidance, published between 2010 and 2023, a total of 14,428 randomized patients, with follow-up ranging between 6 to 60 months. And we performed a 2-stage network meta-analysis according to Prisma guidance, where we first did a standard, random effects and fixed effects meta-analysis of the direct data, and then we generated indirect data from the network. So our primary endpoint was looking at target lesion failure for all of intravascular imaging, that is OCT or IVUS versus angiography guidance. And again, this was 18 trials, over 11,500 patients with close to 1,000 target lesion failure composite events. And overall, the results were very robust. Intravascular imaging reduced target lesion failure by 31%, p less than 0.0001, no heterogeneity between trials. Now, when we looked at the individual components, we actually saw a marked reduction in cardiac death as well as all-cause death. So there was a 46% reduction in cardiac death and a 25% reduction in cardiac death. And both of those were 25% reduction in all-cause death. And both of those were highly statistically significant. So this is the first meta-analysis, the largest and most up-to-date with the longest-term follow-up, and now shows a clear reduction of both cardiac and all-cause death. We also saw statistically significant reductions in target vessel-related MI and all myocardial infarction. We saw reductions in target lesion and target vessel revascularization, approximately 30% reductions, and very impressively, a 52% reduction in stent thrombosis with intravascular imaging guidance. So these results right now are extremely robust and really incontrovertible. Now, when we compared, the results were pretty consistent in the IVUS versus angiography studies and the OCT versus angiography studies. When we look at the OCT guided versus IVUS guided PCI trials, the head-to-head trials, there's before OCT-IVUS only 4 trials with 1,316 randomized patients. And so there's not a lot of direct data yet. There's no statistically significant differences between IVUS guidance and OCT guidance in that data set. And much of the network meta-analysis which supports that conclusion is therefore indirect data. The OCT-IVUS results will really affect those estimates as well. I don't know the results of OCT-IVUS as I give you this interview today, although I'm anticipating that we'll have similar results between IVUS and OCT, but we'll have to see.
So, Greg, when you look at an individual trial, though, recently, Illumian 4, which you were the chairman of, no real difference in outcomes there. How do you reconcile that with your network meta-analysis?
Well, we did see the same kind of trend for reduction in cardiac death and reduction in myocardial infarction. And we saw a 2/3 statistically significant reduction in stent thrombosis. So all of those outcomes were incredibly consistent with what I just told you about. We didn't see in Illumian 4 a reduction in target lesion or target vessel revascularization, likely because a lot of the follow-up was during the COVID period. But when we add that all into the meta-analysis, the Illumian 4 results, even target lesion and target vessel revascularization, are perfectly consistent with all the other data, with 0%, the I-squared is 0, so 0% heterogeneity. And overall, we get a 29% reduction in target lesion and target vessel revascularization with intravascular imaging guidance. So Illumian 4 was a little bit of an outlier there. We think we had mostly probably because of COVID. But either way, when you look at the entire meta-analysis, you see a very robust reduction with both OCT guidance and IVUS guidance.
Great. Great. Thanks for sharing with us today. And thanks to all of you for joining us here from ESC 2023.
Thanks, Mike.